Good day and welcome to all. This is Hangouts with HIVE. And today's Hangout is titled Power Health, Implementing HIV Prevention for Women. It's January 28th, 2016. My name is Yamini Oseguera-Bhatnagar, Power Health Coordinator at HIVE in San Francisco. And I'm joined with 5 amazing colleagues who are going to share their work, their thoughts and experiences. Let's have them introduce themselves, and let's start with Naina.
Great. Hi, everyone, and welcome. I'm Naina Khanna, Executive Director of Positive Women's Network USA. I am calling in today from Oakland, California, and I come to this work as a woman living with HIV. Positive Women's Network USA is a national membership body of women living with HIV. We have chapters all around the country, and we do a lot of leadership development work as well as state level and federal advocacy on behalf of women living with HIV. Glad to be here. Thanks for having me.
Great, thank you. Kim, will you introduce yourself?
Absolutely. Thanks, Yamini. Hi, everyone. This is Kim Koester, and I am a researcher at the Center for AIDS Prevention Studies at the University of California, San Francisco, calling in from San Francisco. And I have a long history of doing qualitative research with people who are living with or affected by HIV. And here today primarily to talk about my passion for PrEP, in particular PrEP for women, and really excited to be here with this crew.
Thank you for joining us. Poppy, will you introduce yourself?
Hi, everybody. My name's Poppy Morgan. I'm coming to you from Chicago, Illinois. I am a woman living with a partner that has HIV. I am HIV negative, and we were able to conceive a child while I was on PrEP. So I'm very passionate about PrEP and reproduction issues for women who are affected by HIV.
Thank you, Poppy. You are an inspiration to many. Jessica, welcome. Will you introduce yourself?
Yeah, hi everyone. My name is Jessica Terlikowski, and I'm with the AIDS Foundation of Chicago. And we work on a number of issues that work to improve reduce new HIV infections, as well as to mobilize communities to improve the lives of people living with HIV. And I specifically work on new prevention technology, education, and advocacy. And we'll be talking with you all today about female condoms, as well as other prevention options for women.
Thank you, Jessica. Last but certainly not least, Shannon, will you introduce yourself?
You bet. Thank you for organizing this, Yamini. I'm Shannon Weber. I'm the director of HIVE, a hub of positive, reproductive, and sexual health. I'm calling in from San Francisco, California. HIVE has a clinic based at the former San Francisco General Hospital, now called Zuckerberg San Francisco Hospital. And we take our lessons learned from this HIVE clinic, where we see women who are living with HIV who are pregnant, or women who have a partner living with HIV who are pregnant or want to be pregnant. And we take our lessons learned from this clinic and share them by disseminating tools and information. And I've long had a passion about helping people who are affected by HIV to have choice around whether or not to have a baby, and particularly around supporting people affected by HIV and having an expanded array of safer conception options. And this is some of my big interest in PrEP, because it really expands that conversation for women.
Thank you, Shannon. Let's talk a little bit more about HIVE. Founded in 1989, HIVE, which is formerly the Bay Area Perinatal AIDS Center, is the umbrella organization that encompasses clinical care, training, advocacy, and a virtual hub for disseminating best practices for comprehensive HIV-informed sexual and reproductive health care, much like Shannon just mentioned. We advocate for increased access to primary HIV prevention for women, a comprehensive HIV prevention toolkit, including family planning and empowered sexuality, the inclusion of reproductive and sexual health in primary care, safer conception options for HIV-affected couples, and much, much more. And you'll hear about much of this today. Our website, HIVEonline.org, is the most comprehensive online resource for HIV-informed reproductive and sexual health care. We have multimedia tools, including videos, printable resources, and these are created for consumers and providers, clinicians alike, in providing the highest quality care and support to people affected by HIV in achieving fulfilling sexual and reproductive lives. Also, with our commitment to ending HIV-related stigma, we highlight stories and voices through the HIVE blog, which is a platform featuring posts from people living with HIV, women who have conceived using PrEP, trans women's experiences, and innovative programs from our collaborators. Now let's talk about HIV in women in the U.S. According to CDC data from 2013, women accounted for 24% of the AIDS diagnoses among adults and adolescents. Also in 2013, women made up 20% of the new HIV infections in the United States, and 84% of these new infections were from heterosexual contact. African American and Latina women are disproportionately affected. In 2010, the total numbers of estimated new infections among women, of the total number of estimated new HIV infections among women, 64% were among African American women, 18% were among white women, and 15% were among Latinas. To get some more perspective on women, HIV, and the perception of risk, let's go to Shannon. Shannon, talk to us about this.
Great. I'm so glad we're starting out with this topic, because I think it's one of the kind of murky areas, and something that I would love for this to be the part of the conversation that we have today and carry forward. Specifically, I want to reference some focus groups that Judy Auerbach led, and Naina was involved with the focus groups that were in Oakland, but they were in 7 cities across the U.S., some before the FDA approval of PrEP, some after. Actually, Jessica's group in Chicago was involved as well, so you can have some more to say. But one of the interesting things that came out of this group of talking with women about PrEP was that even though the women who were in the focus groups had been selected from highly affected or vulnerable populations, vulnerable meaning vulnerable to being exposed to HIV, none of the women saw themselves at risk, at least in the immediate or the near term. And so when we think about that, and I think about since then, these last 4 years of what it's looked like to roll out PrEP to women, I think this concept of risk is something where we get really hung up, because no woman perceives herself to be at risk, right? In fact, I think that we as women balance, when we're engaged in sex or thinking about having a baby, we're balancing lots of different priorities, and we make trade-offs all the time. You know, it may not be the perfect partner, it might not be the right position, it might not be the best sex we like, but we make trade-offs, and we're used to doing this from our early sexual debut. And so if we think about how women think about risk, it's really like we're balancing different priorities. And where does my perception of my vulnerability to HIV rank in my list of priorities? Am I prioritizing intimacy? Am I prioritizing my kids' childcare? Am I prioritizing safety, either in my home or in my community? And I also think we can think about this. There's ways in which we can frame it in which we paint women as vulnerable or victims. And we do want to bring this into the conversation, because women are, women including trans women, have higher rates of violence in our life, both in the community and as well as in our homes. But at the same time, women are so resilient and so powerful, and we thrive on connection. And so let's think about all the ways in which we've managed balancing these priorities so well. And then one other point I want to bring up, I realize I'm not answering any questions, but putting lots of things for us to think about out there, is that when we now are offering PrEP to women, it's mostly in the setting where they have a known HIV positive partner. And in that setting, what is a woman's risk, right? We have done a lot of work around talking about the value of an undetectable viral load, and how that much that decreases the risk of transmission. And so this gets a little bit tricky too, because then it comes down to what does the woman know about or can confirm about her partner's viral load, and how does that sit in their relationship. And so we don't want to undermine the power of the undetectable viral load, it will connect to what I hope Naina talks about too, some with criminalization and disclosure. So how we frame this for women also frames how we will be able to engage with men living with HIV who have sex with women around this conversation. We can't kind of have it both ways. So we need to figure out, I think, some new language to talk about risk and vulnerability and resilience as we think about how we're going to reach the 422,000 women that the CDC say could benefit from PrEP.
Thanks, Shannon. You set the stage. You asked a lot of questions, and I hope that we will delve into some of the issues that you brought up. Next, we're going to go into talking about the experience of trauma and how that affects how we look and perceive our risk, and also the criminalization of HIV and what effects that has on us. Naina, will you talk to us about this?
Sure. Thanks, Yamini, and thanks, Shannon, for laying the ground, I think, so eloquently and clearly. As Shannon, basically alluded to, we really can't talk about risk for women in the U.S. context without looking at structural risk. And so it's not so much behaviors that folks are engaging in that are putting them at risk, although that's frequently how the response to the epidemic for women has been sort of predicated, is on trying to get people to change individual behavior. But when you have a situation where most of the folks being impacted by HIV are tending to be low income, tending to be communities of color, there are all these factors going on around displacement, economic injustice, violence. We have power dynamics in relationships. We're in this system of white supremacy and patriarchy that is really impacting the way that women can even engage with prevention tools, prevention resources, prevention options, healthcare systems, and all of that. And much of these dynamics are institutionalized in the form of criminalization laws, racist policing practices that disproportionately target folks who are already vulnerable to HIV. So, for example, when you have cops out there picking people up for walking while trans, or because they're walking down a certain street at a certain time and the police assume that this person is a sex worker and does a sweep. When we have homelessness sweeps going on, which is happening right now in San Francisco, a lot around the Super Bowl coming in. So a lot of these issues are connected, and so when all of that is happening, people are already are vulnerable because they don't have a safe place to go, they don't have a safe place to sleep. Women in particular might be put in positions, women including trans women, might be put in situations where they have to negotiate, having a safe place to sleep at night, and in a situation where they may not be able to also negotiate condom use or use of other kinds of prevention methods and mechanisms. And so that's really a lot of what is going on in terms of placing folks at risk. But we also know that for women living with HIV, the rates of trauma are exceptionally high. And that's no surprise when you think about everything that I just said, right? So for folks who are likely to acquire HIV, they're also likely to be policed, to experience racism, to experience transphobia, discrimination of all different forms due to how they may present or how others may perceive them. And in addition to experiences that may have happened in their lives, from intimate partner violence to domestic violence, childhood sexual abuse. And so it's really not a surprise when you look at the data, which tells us that 30% of women living with HIV have post-traumatic stress disorder, PTSD, which is the same thing that veterans come home from war with. So basically being a low-income woman of color in this country or another constituency that is disproportionately vulnerable to acquiring HIV is not that different from living in a war zone in terms of the actual impact that it's having on people's bodies, their vulnerability, and their health. And there's an incredible wealth of data that connects trauma to poor health outcomes, not just HIV, right? So trauma can be connected to the way that we process and deal with and cope with and manage our emotions, which sometimes might include substance use, which sometimes might include the way that we form relationships and attachments to people. It can affect so many, which it might include the way that we engage with the healthcare system. And so there's really a wealth of data that sort of documents the relationship between trauma at a very basic biological level, as well as at an emotional and mental and psychological level, and shows these negative health impacts. And if you look at the care continuum for women living with HIV in the U.S. Yamini talked a little bit earlier about how many women are living with HIV in the U.S. Well, we know that for a lot of women living with HIV in the U.S. are not effectively engaged in care, are not effectively are not able to take their medication in a way that would promote suppressed viral load consistently. And so I think we need to be asking, where is the healthcare system failing? If we know that in this country, which is, theoretically one of the richest countries in the world, has about half of women living with HIV out of care, only about a quarter of women living with HIV having a suppressed viral load, but is linking a lot of women to care in the first place, then where is the system failing? And so one of the things we think can be done, and that Positive Women's Network has been working on in collaboration with UCSF Women's HIV program, is really promoting models of trauma-informed care for women living with HIV, but really for all people living with HIV. A way to address and promote healing from trauma, not just medicalization of care. And so I think, just a couple more things I want to mention. HIV diagnosis itself can also place people at disproportionate risk for violence and discrimination. And so that can play out in a lot of different ways in the context of I think, the healthcare system. It can be obvious, but and I think some of the panelists will probably talk about this later, but particularly around sexual and reproductive health care, a lot of women living with HIV and women in partnership with people living with HIV may face discrimination in healthcare settings around sexual and reproductive health and rights, and that can also be traumatizing. Housing. People can be discriminated against in housing settings, in employment settings, and also in the context of relationships. So when you have, when you're a woman living with HIV and you're in a relationship with somebody who may or may not have HIV, there's always the potential for a person living with HIV to be threatened with disclosure of their status, to be coerced around, if a woman has kids, for example, oh, I'm going to out you at your kid's school, or I'm going to out you to your landlord, you might lose your housing, or just something as simple as you are never going to find somebody else, so you better just stay with me, right? So having HIV itself can set up potential for a lot of dynamics within the context of a relationship. And so there is also data that shows that HIV can make women in particular more vulnerable to violence in relationships and less likely to leave violent relationships. Finally, in states that have criminalization laws, and there are over 30 states in the US and territories that have laws criminalizing exposure, non-disclosure of HIV on the books. And so in states where these laws exist, there's tremendous potential for people to fear HIV testing, to fear disclosing their status, to fear engaging in medical care if they are living with HIV, and to fear taking their medication in case they are outed as having HIV, which could result in prosecution. And so there are a lot of great resources out there and folks working to change some of these laws, which basically work by creating a biological underclass of people who can be targeted. And I would recommend that folks check out the website HIV is Not a Crime if you're interested in doing some work around that, and the work of the Zero Project. And so these criminalization laws also, as I'm sure you can see, create a very hostile environment for people living with HIV, which in turn produces trauma. So it's really all a big cycle, and there's a lot of work to do.
Naina, thank you so much. That was not only informative, it was very inspiring, and you are definitely one of those people that are putting in a lot of work around making change where these laws are concerned. Thank you for laying out the land, Shannon and Naina, and telling us what this looks like, HIV in women in this country. What are some of the reasons why the rates of HIV infections among women exist? What are some of the gaps? Now let's move to talk about prevention tools for women. What does this HIV prevention toolbox look like, and what are some of the components of it? Let's start with Jessica telling us what is the importance of email or bottom partner controlled methods of HIV prevention, and maybe you can provide us some examples of that.
Yeah, of course. Thanks, Yamini. I think there's a couple things I'd like to touch on that I think are important here. I mean, we really currently only have one dual protection option for women, right? Something that is a tool that protects against STIs, HIV, and also enables a woman to prevent pregnancy, and that's the female condom, or also known as the internal condom. We only have this one option that's available in the US at this moment, while there are actually other tools that have been developed and are being disseminated in other countries. And advocates like us at the National Female Condom Coalition are actually working to make more of these options available in the US and to really pave the way to enable greater product entry into the US so that women have more than one option to choose from. I think while we're obviously very vocal and passionate and continue to advocate for female condoms, that is just one option. And it has its limitations, and I think in particular one of them is that it still requires some cooperation by a woman's partner. Women need an option that fits the diversity of their experiences, of their contexts, of their needs, and really also of their desires. They want a tool that's going to work best for them in the variety of situations that they encounter in their lives. And as because of this, we really need to continue to ensure that there are more options that are being researched and developed and then implemented. So I think this is one of the reasons that PrEP is so revolutionary for women, is that this is a tool that they can take without folks necessarily knowing, right? There's more. They have greater ability to be discreet in taking PrEP than in terms of using a female condom. I think we'd still like to see more options be made available for women, options that would enable her to reduce her risk of HIV, STIs together, and then also to prevent against, protect against pregnancy. I think one of these pieces of information, excuse me for just a second. Puppies and prevention, you know what I mean? So what I'd like to, I think the other piece that I think is really exciting and is on the horizon, though something that is going to be more, it's in the future, but is ultimately something that we're all striving for, what are called multi-purpose technologies, options that would really offer greater, more broad spectrum against this array of HIV and variety of STIs. As well as pregnancy. So having something disease prevention paired with contraception. And this could come in a variety of modalities. We're looking at vaginal rings that women could use. also looking at long-term injectables. So I think there's a lot of exciting things for us to continue to consider and to advocate for. But I want to get to the point that Nana had also raised too about sort of, the role of institutions and providers and, what we can do to make sure that women know about the options that are currently available, because there's obviously a big disconnect, right? We've had female condoms available for 20 years. Uptake has been far below what we would like it to be. And a big part of that has to do with how information about it is disseminated, or I should say not disseminated. There's a lack of conversations that there's a lack of conversations about female condoms that happen. And I think with having PrEP now available, we have a real responsibility and opportunity to make sure that conversations about PrEP are integrated into regular conversations with women about their HIV risk. And so to talk about this, and just as we would talk about or expect providers to talk with their patients about their needs and desires for contraception, they should also be having conversations about the variety of ways in which they can reduce their risk of HIV.
Thank you, Jessica. Also, Jessica and a couple of other colleagues, we did a hangout a couple of months ago on this topic, lessons learned from the implementation of the female condom in rolling out PrEP for women. And it's actually a very interesting conversation, and you can find that on HIVEonline.org. Moving forward, thank you for that, Jessica. Let's talk specifically about PrEP for women. Does it work, and what does it look like? Kim, will you tell us about this?
Sure, I'd love to tell you about this, and I will give a ringing endorsement to the hangout that you just mentioned, Yamini, on lessons learned regarding the female condom and how to move forward with rolling out PrEP. I found that to be a very informative conversation, and I hope to bring in some of the ideas that sparked for me while listening to that into this conversation. First, PrEP for women. I think the question you asked, Yamini, is whether it works, and the answer to that is absolutely. PrEP works for women, and we know that because the FDA approved the use of Truvada as PrEP in 2012 for women and men and trans people. So it most certainly works for women. The message we want to continue to promote and be on point about, and I think this is certainly something that we hear over and over again, those of us who are sort of living and breathing in the world of PrEP. It works, PrEP works when it is taken, and this becomes very important for bodies with vaginas or people who are having vaginal sex. It is important that women take, or people who are having vaginal sex, that they take Truvada regularly, and that means every day. So PrEP works when taken is the message that we have seen circulating around a lot. And I want to underscore that here, that it does operate a little differently in bodies with vaginas than it does with people who are having anal sex. So it works when taken. So yes, PrEP works when taken. And I appreciate that, Shannon, you mentioned the number of women that the CDC feels might be benefit from the use of PrEP. I actually didn't know it was somewhere in the 400,000s. I think that's a pretty astounding number in relation to the number of women who are actually using PrEP in this moment in time. So we are still in the early days of PrEP rollout, and the predominant users in the United States really are gay men. And there are reasons that we could talk about as to why it is that there are so many more gay men who are taking PrEP and have access to PrEP and know about PrEP versus the knowledge base around women. But I would like to just focus on maybe talking about how to promote and build awareness about PrEP for women on this particular hangout. And I'll return to the ideas that I thought about when I was listening to Jessica and the other speakers on the hangout that really focused on the female condom. And I was thinking about, well, what kind of lessons learned can I think of in my work with gay men? Because so much of my research on PrEP has focused on how PrEP users, male PrEP users, are responding to the idea of PrEP, and what is it doing for them? What are the sort of the controversies and the conversations that men are having around PrEP, and where do those conversations link up with how women might think about PrEP, and where do they completely fall apart? Like, why, in what ways are men and women similar in terms of their interest in PrEP? Because I think there are actually potentially more similarities than differences. Women, like men in gay relationships who bottom, are more vulnerable. So in some ways, men who bottom and women could be, they're just similarly positioned in the sexual act. And they may have very similar concerns. And I will say that it's not just women who might want to be discreet about their PrEP use. I hear you, Jessica, that in terms of the female condom, it does still require negotiation with a partner, and PrEP doesn't, and that's a great thing because it's women controlled, and you don't have to let your partners know. This is something that has real value for gay men as well. Not all gay men want to be out about their PrEP use. They really don't. There's good reasons why they may want to be discreet about that, and so I feel like we might want to become allies with those with people who don't want to come out as PrEP champions. And I think it's important to recognize the ways in which men and women are going to have a similar thinking around PrEP, because we can borrow some of the exciting ways in which PrEP has been promoted among gay men. We might be able to borrow some of those ideas from women, and I know we plan to talk a little bit more about that later on in the Hangouts. Maybe I'll end my comments about that there. Yamini, did you have any other questions about PrEP in women that you wanted me to respond to more generally?
We'll come back to PrEP for conception, and then maybe we'll talk more about it then.
Okay.
But thank you. That was very helpful. And thank you for talking about building bridges and becoming allies, because we have to do that in order to make prevention happen overall across the board. So thank you very much for that. Let's go to Poppy, and let's talk about treatment as prevention. Like I said at the very beginning, a large percentage of women who are living with HIV acquired HIV through heterosexual contact, and some of these women may be in longer-term relationships with their positive partner, etc. Let's talk about how women can support partners in achieving treatment as prevention, and maybe Poppy, you can tell us about that.
Sure. Well, thank you for this opportunity. So as I mentioned in the intro, I am an HIV negative woman, and I am married to an HIV positive man. We've been married for about 14 years. And I think, one of the most important things for a person who is supporting a partner that is HIV positive is to some agreements around how you're going to navigate your relationship. What are some understandings or boundaries that you're going to have with each other in terms of support, in terms of disclosure, in terms of, are you going to go to doctor's appointments with the partner to help be a healthcare advocate? How are you going to navigate the subject of disclosure with family, with friends, while maintaining a support system for yourself? And how are you going to support your partner on the healthcare decisions if they want your support on that? So, and also sex. I think there has to be some important understandings and discussion around the subject of sex if you're going to have a relationship with a partner that's HIV positive. And some of these conversations can be very difficult and can be very awkward, but I have found in my relationship are very necessary. So in my, I can only speak about my own relationship, but I know that what was important to me after establishing these understandings was that I wanted to get educated myself. I wanted to educate myself on the terminology, on kind of the latest research, on the latest medications that were the lab work. How do I understand what just the basic kind of medical jargon, any side effects of medication. So those are all things that I wanted to educate myself on first. And then how, my partner wanted my support in terms of a healthy lifestyle. So we had to come to some agreements around how I support him with that. And, we came to an agreement that he didn't want me harping on him to take his meds. So, we had to kind of establish a system where he could stay on his healthcare regimen in terms of taking his medications. So, it just meant we had to buy, like those pill dispensers that show, if you've taken your meds that day or not. He ended up having to carry kind of an extra little dose of medication with him at work or when he's around, so that if he kind of remembers that he forgot to take them, he has a stash with him at all times. He wanted me to go to doctor appointments with him and kind of, advocate for him in terms of, with his doctors. So, for him, that was important. Those were important ways that I could support. But some people want that reminder to take their meds. Some people, set alarms. So I think that whatever kind of agreements you come to with your partner is what is important to stick with. And it's hard. Sometimes I have to really bite my tongue, and I don't want to impose on the boundary that we set. So it's just important for us. And then I think the last thing is I would really, really highly recommend finding a way to get support, whether that is, through telling a really trusted friend. For me, I actually ended up making a blog because there was not really any kind of outside support that was adequate for me at the time. So, you can journal about it, you can write about it, it kind of just whatever works for you, but I found that getting support is important. There are things that you just you don't feel comfortable talking to your partner about in terms of coming to terms with their status and what it means for your own life. And so I think that's why it's so important to just have that support. I think, just because I think both partners need that support. But and then I would also just say around disclosure, again, I think that's got to be a really kind of thoroughly processed topic, because if you're going to talk to, say, a trusted friend about your situation, you have to make sure that your partner is okay with that disclosure to that trusted friend. And sometimes, like for an example with my husband, he has disclosed to people his own status, but he still doesn't want me to talk to those people about his status. So there's always these nuances and these things that just need to be talked through and processed through, and I think that's just really important. It's keeping that communication open and coming to some really strong understandings about how you're going to navigate life together. And then I just do want to say, like, life is normal. It's not like, HIV takes over everything, and there are times that we have sex and I don't even think about the fact that he is HIV positive, and we have a daughter, and we go weeks without it crossing our mind. And so I know that in the beginning I thought it was going to be such a big part of our life, and it's really not. So I would just say to people that life is pretty normal, and that there are just some things that kind of come up now and then, but you're still capable of having an amazing love story with the partner, and that's been my experience. So that's it.
Poppy, thank you so very much for two things. One, for affirming that people living with HIV are and can lead very complete, fulfilling lives just like anyone else. And HIV is a chronic, manageable condition. And also, thank you for illuminating these conversations that we have as advocates, providers on a regular basis with your experience. That is so very important. So thank you for that. Let's go right back into talking about other issues that need considering when we talk about HIV prevention for women. And we're actually going to go right back to Poppy to talk about reproductive desires of women in serodifferent relationships. So right back at you, Poppy.
Thank you. So, as I mentioned, I've been in a relationship with an HIV, with a person living with HIV for the past 14 years. And we went on a very, very long journey to try to navigate around how do we start a family. And so this journey started in 2000 for us. It's been a long road. But I do want to just start by saying that you can absolutely start a family. You can, having access to all kinds of the latest technologies that we didn't used to have makes it very, very possible and accessible for people when it didn't used to be. I would say first, for us, I started by doing the research. I talked to his doctor. I contacted HIVE, back then it was called BAPAC, about what our options were. Our options at the time were sperm washing, IVF, adoption, sperm donor, and those were kind of the options for a long time before PrEP came along. And we looked extensively into each of those options. And again, I'm kind of just in a nutshell telling you our story, but this was a 14-year-long journey. So there was a lot of, years and years of kind of going back and forth and trying to figure out what options are going to work best for us. So do your research about, what works, what's going to work for you. We were actually at the point of going with a sperm donor. We had chosen a sperm donor this was in 2010, when I got the phone call from Shannon Weber about the possibility of us using PrEP. This was, a couple years before the FDA approved PrEP, so we talked about having a doctor prescribe it off-label for us, and I did talk to my primary care physician about it. She initially refused to prescribe it to me, I think because she had concerns since it wasn't FDA approved yet. So the lesson there is, just keep pushing, keep, pursuing. And Shannon was able to put us in touch with a doctor that was willing to prescribe PrEP for us off-label. And so I started PrEP in early 2011. I got pregnant in 2012. And we had a healthy baby girl in 2013, and she's going to be 3 now in April, which is just amazing. But what I learned through the process is that you have to just listen to your intuition about what it is you want. I think sometimes medical professionals want to make sure that we're as safe or that we're taking into account all the risks. And I think that that's important to listen to, but I also think that you have to really kind of be in charge of how you follow your gut instinct. And, I think sometimes we have to really kind of push, and sometimes that means finding a different doctor or finding a different avenue to achieve the outcome that you want to achieve. And so for us, it meant finding a different doctor, and I'm very thankful I was able to do that. And then also just kind of, I had to always check in with my husband. I think that every step of the way, he felt guilty about, the fact that we even have to go to these extremes or talk to these specialists. And so just kind of always staying in touch with, how each other is feeling was a really important part of our journey. And then, always get support. Like I said, I just recently started meeting women who were on PrEP or who are also in relationships with HIV-positive individuals. And so, this is at the end of a 14-year-long journey. I know that there are women out there like me. I know, they contact me through my blog, and I know that they contact a lot of the people we're talking to today. I just personally had never been in touch with somebody in my position, and so I think a lot of us feel like we're just the only ones out there kind of navigating this expanse of questions and fears. And so it's just important to know you're not alone and that there is support out there. And I think, going to HIVE Online is a really important step to finding that support. But I think that's just paramount when you're going through something as complex as anything really dealing with fertility or conception. It has so many complex layers to it. And so you want to get as much support as possible. And so currently now we're trying to have baby number 2. We personally made this decision for me to no longer be on PrEP. I don't know that decision's going to stay, but that's where we are now. So we'll keep you updated on how that goes. But there is support out there, and it is possible, and it's really exciting to be part of all the possibilities out there right now.
Mm-hmm.
Thank you, Poppy, and thank you for your blog, HIV Negative Spouses. You could probably Google HIV Negative Spouses and it'll come up. And it has been very supportive and inspirational to many. Let's move forward talking about other issues to consider. Healthy sexuality, what does that mean for women? And what does sex-positive messaging look like? Naina, tell us more about that.
Thanks, Yamini. Well, I think, certainly in the U.S. context, not having what's considered a generalized epidemic here among women with HIV or in the general population, the response to sexuality of people living with HIV has historically been very shaming, very sex negative. And you see that reflected even if you look at the National HIV/AIDS Strategy, which was recently released in July of last year. There's a new 5-year National HIV/AIDS Strategy, which is basically the plan to address the domestic epidemic from a prevention and care and rights perspective. And it's a pretty good strategy, but there's a lot of sex-negative language in there. And this is in a broader context, right? Beyond HIV, we live in a culture that is very shaming of sexuality, and particularly sexuality of women, sexuality of anybody who identifies on the LGBT spectrum. And so the conversations around PLHIV sexuality have been really not historically affirming. And that is reflected at the highest levels of policy and decision making. It penetrates through program design and through implementation in a lot of cases. I think, here in the Bay Area and in some other parts of the country, especially where we have Ryan White Part D programs and other kinds of programs that have historically been created and built for communities impacted by HIV, we have sort of these bubbles of amazing spaces with incredibly competent and committed providers who are working actively to destigmatize sexuality and reproduction of people living with HIV. And I think that's a lot of what Poppy's talking about with respect to the amazing work that HIVE has done and has been doing over the years. And that is really a gift and a blessing, but it's also under threat. And so we see increasingly, a lack of funding, a lack of resources directed towards healthy sexuality, reproductive rights of people living with HIV, even though 30+ years into the epidemic today, people living with HIV of all genders are wanting to create families, are living a long time, and are thinking about constructing families differently. And so we really need to be investing more resources into this, not less. And the Part D program, although it was developed, sort of for women living with HIV, it was really more developed to protect babies from acquiring HIV from us. It was actually not really created for women. And so when sexuality of women living with HIV has been constructed historically, it's usually been in the context of reproduction. So it hasn't really been about, it's been sort of exclusively about how do we reproduce, or how can our reproduction be controlled? How can it be policed? How can it be constructed in a way that will be as minimally detrimental to other people as possible? And so we're in a different era today where we really need to be thinking about how do we uphold full sexual rights and pleasure of all people living with HIV, which includes, kind of hearkening back to the conversation we were having earlier about HIV criminalization laws. That's certainly a huge impediment. But beyond that, we're also finding that this conversation about viral suppression, we have incredible data today that shows that viral suppression is a very effective prevention strategy. It's really, really effective. It works. It works really well. If a person living with HIV is virally suppressed and taking their medication as prescribed, consistently virally suppressed, and there are not other STIs going on in the partnership. There isn't anything. There's nothing leaking, oozing. It's very unlikely. It's almost impossible to transmit HIV to a negative partner. And so the disheartening thing about that is looking at the discrepancy in which that message is being uptaken in different communities. And so that is something that we really see as a human rights violation. So we have this incredible data now that basically shows people living with HIV can have condomless sex with a suppressed viral load and not really have to worry about transmitting HIV to their partners. That's amazing. That's really incredible. That's revolutionary. But how many people with HIV don't know that? How many providers are not communicating this information to their patients, to their clients? How much of the HIV workforce has not really been adequately sort of retrained on this new information? And so this isn't just about medical providers, right? There are social workers, there are case managers, there are peer advocates, there are a lot of folks in the mix interacting with people. And due to kind of decades of internalized stigma, potentially negative interactions with folks, by folks with the healthcare system and with providers around their sexuality, people may not have this information. It's not necessarily getting out there, and we're finding that several years after the data, very conclusive data from these studies came out in the academic literature, women with HIV, about half of women with HIV that we've been surveying still don't know that if their viral load is suppressed, or they have not heard it from a provider, that if their viral load is suppressed, they are much less likely to transmit HIV to a partner. And so we really see that at PWN USA as an incredible human rights violation, an incredible opportunity also to reduce internalized stigma, to think differently about constructing a whole spectrum of sexual and reproductive options for all people living with HIV. And I know that there's some incredible work happening on this, in particular that Jessica is helping to lead with the Midwest AETC, and hopefully she'll get to talk about that a little bit too.
Thank you, Naina. And thank you for bringing us back to the conversation back to talking about women living with HIV. Those bridges also need to be built, women living with HIV and HIV negative women. We are essentially the same women. There's just a diagnosis in between. Let's talk about what have we learned from implementing HIV prevention programming for women. And so thank you for talking about Jessica's work, Naina, because we go to Jessica to talk about, and we're running short of time, so talk really quickly about implementing and offering female condom, and what have we learned from this process?
Sure. Yeah, I mean, I think, what we've learned is that it hasn't been offered. I mean, so the upshot is that, we don't provide the information, we don't provide the product, and as a result, a lot of women continue to not know that it's an option, and access remains very, very limited. And I think, one of the things that I'm really excited about in the project that Naina mentioned is the Midwest HIV Prevention and Pregnancy Planning Initiative, in which we're really taking some of the lessons learned about female condom to that program, in which we're really reaching out to both the HIV clinicians as well as those clinicians that are providing reproductive health care to individuals, both those that are living with HIV as well as those that may have an unknown HIV status or in vulnerable communities. And really helping them understand what is going on with the latest in HIV prevention, the developments that have been made, this incredible advancement and radical notion that people living with HIV can have safe, healthy, exciting, satisfying sex lives, and really helping to get that message out, and being able to frame this issue as one of really affirming people living with HIV sexual and reproductive health and justice for them. And I think that's something that's really important and matters. So I think, you know, this project is one piece in trying to achieve that goal, by really just creating these spaces for providers to, one, know about what's going on with the latest in prevention, and two, to provide them with the tools to have these conversations with their patients, and to have them in a way that is positive and affirming, and creates a space that really acknowledges people's sexuality in a positive way.
Thank you, Jessica, for bringing the conversation full circle back to sex positivity and healthy sexuality. Shannon, will you tell us, in a nutshell, what have we learned so far from implementing and offering PrEP to women?
So I'm going to just quickly talk about it in relation to safer conception, because I think that's where we've made the most progress. And I can kind of say in a nutshell, one, that women are included in all the guidelines, including the use of PrEP for preconception or pregnancy. American College of Obstetricians and Gynecologists was the first one to come out with guidelines, even before the CDC. Very women-centered approach. The CDC has guidelines, the WHO has guidelines, and the Association of American Society of Reproductive Medicine, so endocrinologists, the fertility folks now also have included PrEP. So it's in guidelines. Now, I do see that we see providers offering it with some sort of permission giving still to women. Just a call 2 nights ago from an awesome provider saying, hey, I just want to check in, because people are still kind of like deeming whether or not women is it good enough? And whatever makes a woman good enough to get PrEP. And it's sometimes whether her partner has an undetectable viral load or not. Anyways, the permission giving thing needs to go away. We're also seeing that PrEP in the setting of preconception, pregnancy, and lactation is not consistently being offered as the guidelines say that it should be. We did a review of cases which we'll present at the Women Virology meeting before CROI, looking here in San Francisco and also at Bronx, Lebanon. And women are not consistently offered PEP when they've had a recent exposure. They're not even consistently offered PrEP when they fit the guidelines. So we have a lot of muscle to build in terms of figuring out how to have these conversations at the clinic level, and then also empowering women to expect and demand these conversations. I think Poppy's such a shining light in that, like that she really paved this road where no woman had gone before, and is now willing to speak about how do you navigate these conversations with your partner and your provider, and it's going to be different for every person. So one, the lesson is it's possible. The hard work is done. It's in the guidelines. Two, we have a lot of work to do to make sure that it's consistently and uniformly offered.
Thank you, Shannon. That's very similar from Naina's message around providers knowing about treatment as prevention and that it works. And so it sounds like we have a lot of education to do.
I know we're done, but there's one thing I wanted to say. There's such value in us figuring this out, because whether you're impacted with HIV or not, the narrative around how we choose to partner and whether or not to have children are the big narratives in our lives. And HIV makes people think that they can't opt into that story in the same way, and that is a lie. That is a lie that we have told ourselves and that we continue to perpetuate. And because of that, we're cheating people from having this compelling narrative, their own story. And so we have got to figure this out so that people have choice. Choosing not to have a child is just as valuable as choice as choosing to have one, right? Because you were able to opt in. And so I just had to put that plug in by saying that there's hundreds of thousands of people that are impacted by this in the U.S. and millions globally, and we need to do this because of the human connection and this narrative story in our lives.
Absolutely. And thank you for the work that you do every day, Shannon Weber. Let's talk about what's next. What is next? Kim, will you tell us how can we reach women better?
I think it's an outstanding question. I think this is one step forward in attempting to reach women. Let's try to reach women online. Let's talk to the people we see in our everyday lives. I think the research shows that women don't know about PrEP, but when they learn about PrEP, they're excited by it, and we just need to keep on talking about PrEP to everyone in our social networks, to just continue to promote PrEP. But I think that we are in the early stages of figuring out how to notify women about PrEP. I will say that we are about to launch a PrEP for Women study in a primary care clinic in East Oakland. And this is moving outside of HIV clinics. It's moving outside of let's offer PrEP to women who are in serodiscordant relationship, known serodifferent relationships. Let's offer PrEP to women in a setting that they are coming into over the course of taking care of their health. So I think what's next is let's see what happens when primary care providers start talking to women about this pill that prevents HIV. I would say stay tuned for information about how women react to that information. I can tell you that the clinicians are really excited about offering PrEP to their patients. So again, these are internal medicine folks, these are NPs, these are midwives who are serving patients in a public clinic in East Oakland, and they think that this is the right thing to do. They want to make PrEP available to women. So I find that really heartening that we know that providers are our partners in getting the word out about treatment as prevention, the female condom, and certainly PrEP. And so I want to say that there are champions out there, and let's continue to support them. Let's find out what clinicians need. Let's find out what women want to hear, how they want to hear about it. Maybe they want to hear about it from their provider, but maybe they want to hear about it from Poppy or Yamini or the Warm Line. I think these are all open questions. So let's keep talking, and let's change the narrative to make family planning and opting in or opting out of parenthood really possible. Thank you, Shannon, for being so eloquent about that.
Thanks, Kim. It's so exciting that this work is happening on the other side of the bridge in Oakland. Also, there's similar work happening in Houston, and Shannon actually interviewed folks from the Thomas Street Clinic, and those videos are also on the HIVEonline.org website, so check those out. And there's work like this happening in many places. Poppy, tell us, what support is still needed from advocates, from providers? What tools can we create that are still missing?
Well, I'm just so inspired by this conversation we're having. I think the most important tool is to communicate. And, for me, I was just talking to Shannon about how there was one doctor that looked at my husband's lab work and said, oh, you're undetectable. Have you guys ever thought about starting a family? And that was the first time we had ever had a conversation where it was a positive conversation around us starting a family. And for whatever reason, that felt like permission to us to kind of pursue this idea of having starting a family. And that was a really, really pivotal turning point for us. And so had that doctor never asked that question, I don't know, where we'd be now. But I think it's just really important to talk to people that we're coming in contact with about what are their goals for their care and dreams, if they have any, and just kind of being open. And I just there is a lot of stigma around HIV that I still battle every day. Like Poppy, it's not my real name, and so I think that the more that we're normalizing the possibilities, the more that we're talking about how HIV is not this, it's not like, in some ways when we had like hysteria around Ebola, it reminded me a lot of the HIV hysteria that we had. And so that sticks with a lot of people, and so we're still to this day overcoming that stigma. So it's just important to communicate. People are coming from all kinds of backgrounds, and just ask the questions, provide the support, know the resources to offer.
Great. Poppy, thank you for everything that you've offered us and the world in these last years. I just want to say thank you to all panelists, Shannon, Naina, Kim, Jessica, Poppy. This was a riveting conversation, and I want to say that there will be work done that's informed by this conversation in the coming year, and I hope to build with you together and to disseminate also what we've just created here today. Thank you very much. And for those watching, the slides at the end of this broadcast will be made clickable so you can be led straight to the resources that we've talked about and many, many other resources on the HIVEonline.org website, in addition to resources that will be provided by our panelists. And from San Francisco, I'd like to end this broadcast. Have a wonderful day.
Thank you.
Bye.
Thanks, everyone. Bye-bye.
Bye.